Hypertension affects billions of people globally, but you know what? Calm down and take a deep breath because you are not the only one it is affecting. And this disease is preventable and manageable. Hypertension is usually referred to as a silent killer because it does not show signs and symptoms on time until it has destroyed the vital part of the body. And hypertension can be in the body for years without you noticing. But the best way to know you have hypertension is through a regular medical checkup. When you go to the hospital and have your BP checked, you're going to know if you have hypertension or not. However, you can experience some signs and symptoms, and that is what I'm going to be discussing into this video. Hi everyone, welcome to my YouTube channel, Ask Your Nurse. If you are seeing my video for the first time, I'm Ashamu Oluwaseun. I'm a registered nurse, registered midwife with a Bachelor of Nursing Science. Thanks for stopping by. This channel focuses on content related to health. And don't forget to like, to subscribe and hit the notification bell below to be the first person to know anytime I upload another new video. And to my returning subscribers, thank you guys for all you do. As I have said, that the best way to know you have hypertension is through a regular medical checkup. Go to the hospital and have your BP checked. However, you might experience some signs and symptoms, and that is what I'm going to be discussing today. And the number one sign you might experience is headache. This type of headache usually occur in the morning or any time of the day at the back of the head, throbbing and pulsating. And this type of headache is not usually relieved by pain relief. You will use paracetamol, it will not go. Some people even go ahead to treat malaria, this headache still remains. Think of hypertension, go to your hospital and have your BP checked because when the BP is too high, it can increase the intracranial pressure, thereby stretching the pain-sensitive structure in the brain, or a very high pressure can stimulate the pain receptor in the brain, causing your headache, and it will not go until your BP is brought down. So go to the hospital and have your BP checked. Another sign is dizziness. When you begin to have dizziness or lightheadedness, think of hypertension because when the BP is too high, it can destroy the blood vessel that supplies blood and glucose to the brain, thereby causing dizziness. So go to the hospital and have your BP checked if you have dizziness. And another one is blurred vision or visual disturbance. We're able to see before, but now you are not seeing clearly again. This can be as a result of hypertension, which can even destroy the retina of your eyes and cause total blindness. So quickly have your BP checked and take action. Another sign is shortness of breath. When you walk a little distance and you're tired and breathless, this can be as a result of fluid retention or strain on the heart. Think of hypertension. Another sign is palpitation. Normally, you are not supposed to be aware of your heartbeat, but when you begin to notice your heart beating, begin to hear your heartbeat or an irregular or rapid heartbeat, think of hypertension and have your BP checked. Another sign is chest pain, especially left-sided pain. When this pain is located at your left side, that radiates to the middle of the chest, think of hypertension because when the blood pressure is too high, it can reduce blood supply to the heart muscle. And the heart, there is usually vasoconstriction, that is narrowing of the blood vessel, so the heart begins to work more, and increased workload on the heart can cause chest pain because you are overworking the heart. It can cause chest pain that is usually located towards the left side, radiating to the middle of the chest. Think of hypertension. Another sign is fatigue and weakness. In chronic hypertension, there is usually vasoconstriction, that is, the blood vessels are narrowed. So, when these blood vessels are narrowed, it reduces the blood supply to the tissues and the muscle, thereby making you to feel tired easily because it is blood that contains oxygen and glucose that will give you strength. But since these muscles and tissue are not getting enough blood supply and enough glucose, you feel tired on time. When you wake up, instead of you to feel refreshed and energized, you feel tired. You do little work, you're tired. Think of hypertension and have your BP checked. Another one is nose bleeding. If you're an adult over 30 years of age and you're having nose bleeding, this usually occurs if the blood pressure is too high and it ruptures the tiny blood vessels in the nose. So when you're having nose bleeding and you're an adult, quickly have your BP checked and rule out hypertension. And now the last sign that I'll be sharing with you today is pedal edema, or swelling of the feet, the, the leg and your ankle. When you notice this swelling and sometimes it pits, when this swelling pits, when you press it, instead of it to rise immediately, you see that it is not rising, it is pitting. Think of hypertension, because when there is chronic hypertension, when the blood pressure is too high, it can destroy the blood vessels in the extremities, thereby leading to leakages of fluid and other contents into the tissue. Also, increased blood pressure or hypertension can destroy the heart and prevent venous return to the heart. That is, blood going back to the heart is reduced because the heart cannot perform its functions properly, which causes fluid retention at the lower extremities. So when you're having edema at the lower extremity or on your legs, your feet or your ankle, think of hypertension and quickly have your BP checked before it leads to complications. Thank you so much for listening. I hope you have gained one thing or the other today. Please, after watching this video, quickly go to the hospital and have your BP checked to prevent complications that can arise from this hypertension. And if you don't have hypertension, ensure you live a healthy lifestyle to be able to continue to have a good and a normal blood pressure. Thank you so much. Bye bye.